Traditional lower blepharoplasty involves excessive excision of the skin and muscle, which can result in the loss of the pretarsal roll, love band. However, since my primary goal is fat repositioning, I perform skin and muscle excision as conservatively as possible. The two incision is made for lifting purposes. If the skin and muscle are excessively excised, like in a typical lower blepharoplasty, the under eye area becomes too flat. When the eye area becomes flat, the surgical scar actually becomes more prominent. The reason patients worry about postoperative scarring is that they have seen many poor outcomes from traditional lower blepharoplasty involving excessive skin and muscle removal. My surgical method is not a simple lower blepharoplasty, but an incisional fat repositioning. There are patients who do not have deep wrinkles but exhibit a subtle demarcation due to anatomical fat prolapse. They have under eyes where this barely visible sagging creates a dark and tired impression. Many patients come in simply for fat repositioning, but even for these individuals, combining it with a skin incision and lateral canthal fixation and muscle adjustment can yield significantly better results. A surgery rushed in 30 minutes can never address such subtle sogging or the details of tonal irregularities. The reason ST insists on a 2-hour surgical time is to completely erase even the traces of aging. The surgical results prove this. Consequently, a lifting effect can occur where the muscle also becomes slightly taut. The scar is barely noticeable. Do you see this scar? It is barely visible. While the incision mark is unnoticeable, the pretarsal roll naturally remains intact, like this when smiling. Releasing the tear trough ligament and providing a concealer-like effect through fat grafting is the foundation. The skin and muscle are incised solely for lifting purposes, removing only a minimal amount of unnecessary tissue. Excessive excision is not the goal. Traditional lower blepharoplasty does not reposition the fat. So what happens then? You're not trying to produce the results of what the skin and muscle ligaments because you're just going to need the compression correction. What happens if you cut out too much? The pretarsal roll disappears. Such side effects can occur and excessive tension is applied to the skin, which creates a tendency for the wound to separate. If that happens, the scar appears much wider and more unsightly. This is why the scar becomes conspicuous. I hope you understand that the incisional fat repositioning surgery I perform is fundamentally different from traditional methods in order to resolve these issues. You do not need to worry about scarring, and I preserve the orbicularis oculi muscle as conservatively as possible. It is also a surgery that does not blindly remove fat, but rather preserves it as much as possible and repositions it to its proper anatomical place. Please look at this photo. This is the patient looking upward. The heavy, tired, and dark-looking under eye area has improved significantly, hasn't it? The under eye is smooth, yet the pretarsal roll remains fully intact. Preserving the pretarsal roll is important, but can you see any scars? You cannot.